Hello, everyone. And once again, welcome to the Vizient Connection Summit here in the beautiful Wynn Hotel in Las Vegas. You're hanging out at the podcast studio. I'm your host, Tommy Kane, and we've got 3 full, amazing days full of great podcasts coming at you. And we're going to start it all off today with our good friends from PDC. And our topic for this podcast is going to be navigating EHR transitions, how proper prep and the right suppliers can avoid costly disruptions at go live. EHR transitions and upgrades are happening fast across the health systems. In this episode, healthcare standardization expert Melanie Sweeny of PDC shares best practices for preparing your organization for a smooth migration. Learn why early supplier involvement is crucial, how wristbands, labels, printers, and scanners affect patient safety and workflows, and steps to prevent costly disruptions at go live. Whether moving to Epic or another platform, discover how product compatibility, standardization, and supplier collaboration drive seamless transitions and successful clinical enablement. Now that's an introduction.
Yes, it is.
Melanie, it's good to see you again. Thanks for being with us.
Same.
Yeah. Let's start with a really quick and easy question for you. Give us a little summary of your background in the company, PDC, and what do you guys really do?
Yeah, so I am Melanie Sweeny. I'm a national account manager for PDC. And at PDC, what we do is provide solutions to help healthcare providers identify pretty much anything within their facility. So most of us are born with a wristband at birth. So those wristbands, the medication labels that are probably used on specimens as we draw blood and tubing throughout the way. And then also printers and the scanners that scan it throughout the entire process. I work with group purchasing organizations like Vizient and health systems across the country to really standardize the products that they're using, standardize their workflows, and ultimately, make it a safe environment with efficient workflows for their patients and the care that they're providing.
And the stuff that you guys do is so critical and so important to just the success of the hospital, but more importantly, just the well-being of the patients, correct?
Oh, absolutely. Last year we were talking about misidentification errors, and that's a huge problem in the U.S. and within health systems all across the country.
Okay, so diving into the EHR transitions, what are some of the best practices our health systems should be aware of specific to EHR transitions?
Well, first and foremost, I think there's a lot of things that get overlooked when you're going through an EHR transition. You can't overlook the small details, and I probably can't stress enough that it is not an IT project alone. So first I would say, assess your products. Look at your wristbands, look at your labels, look at your hardware, the printers, the scanners, are they all compatible to this new system that you're going to be using? You might even want to test your scan rates of your scanners at that time, because maybe that's something else that you can update through this process. But I think probably the more important is involve, secondly, all the right people from the start. I said it wasn't an IT project, so involve supply chain, involve your clinicians, right? You might have a VAT team specifically that evaluates products, involve your EHR consultant, and probably the most important piece is your supplier, right? You want to make sure that along this transition and this migration that you're picking the media that is going to work with these EHR systems. Having everyone at that table kind of ensures that you're picking the right products. They're chosen in a way that isn't going to disrupt your workflow. And it also makes sure that having your supplier and EHR consultant kind of at a start or the minimum, you can make sure that along the way, all of the testing and the printing and the workflows are efficient, and you don't have problems post go live where clinicians might have to do workarounds, right?
Right. So you just want to make it as efficient as possible, like try to avoid all the potholes at the beginning because you know what's coming, trying to really set yourself up for success.
Absolutely. It saves a lot of time. It saves a lot of headaches. It helps keep your costs low, and it makes it an efficient project along the way.
Why is it important to consider identification products in particular when switching to a new EHR system such as Epic?
Well, when you're switching to a new EHR system, really identification products by nature, they're going to be changed in that way, right? And wristbands, labels, printers, all of those connect directly to that EHR. An EHR at its core is essentially, the core of healthcare operations.
Sure, no doubt.
Right? If all of those pieces don't work together along the way, then you risk, misidentification.
Right.
You risk things like scanning errors, right? If you didn't test those barcode scanners in your kind of testing phase. And that's why I think it's important to not just rely on a consultant or a single stakeholder and what they might recommend.
Right.
Because having that cross-collaborative team is really the best way that you're going to ensure that you pick the right products, they're working the right way, and that your go-live goes as smooth as possible.
Because everything has really got to all work together.
They're all connected.
It's all connected, right?
It's all connected. I mean, every patient needs that wristband as you go into a hospital.
Right.
All of those specimens along the way, and as you're working through figuring out, what is their healthcare plan, all of those things have to work.
And there's really very little room, if not any, for error. I mean, you just can't have error.
No,
right.
Or it's going to cost you a lot of money.
Yeah, exactly, exactly. Speaking of disruptions, what type of disruptions can arise if products aren't EHR compatible?
I touched on it a little bit, but really if you don't pick products that are compatible from the start, right? You could have patient ID bands that aren't printing out the correct information. They might be printing in a way that isn't able to be scanned, right? If you have not tested the label formats and your labels aren't printing out the right way, it can slow down everything really throughout that process and frustrate your staff. They're going to create workarounds, which I talked a lot about last year. Again, if your printing isn't printing in the right heat settings or printing in the right way, your barcodes may not be readable. I mean, ultimately, at the end of the day, all it's going to run into is scanning failures, misidentification, and workarounds. But some other things, too, is we often overlook that the products you're selecting, are they on your GPO contracts? Right? Are they a part of the purchasing agreements that you're a part of, whether it's Vizient or others? Are you buying from suppliers that are contracted? Are you buying from suppliers that manufacture, suppliers that can help you support supply chain resiliency along the way too, right? All of those things are really important when you're looking at EHR compatible.
Okay. It's fascinating because for somebody like myself that's not like in the trenches of a hospital going through all that kind of process, hearing about all this and knowing how much detail and how people have to pay attention so much to all those little things to make it all work together, because it has to work together for the good of the patient. It's just fascinating. Why is standardization so important when we're transitioning to a new EHR system?
So standardization, I think, is a thing that a lot of people talk about as a priority. It comes up time and time again, but in reality, you have a hard time prioritizing it, planning it through in your projects and what you're going to work on for each fiscal year. But I think standardization is probably one of the smartest moves during an EHR transition. And why? Well, because you're going to change products anyways, right? You're going to be changing your labels to match these EHR modules. You might even be changing the patient ID bands to improve a workflow. So taking that time during the EHR transition to standardize is really the best way that you can align that standardization project with what you're already doing. But it gives you the opportunity to, to reduce your product SKUs. You can reduce the amount of suppliers. And at PDC, we have a program called Value Plus, which really is meant to do that, right? It's meant to help you reduce redundancies in the products that you're sourcing, help you identify products that could be more efficient, reduce your suppliers. And really, it just kind of creates that consistency amongst your health system, especially if you have staff that may go from one location to another. And really, the end result is just a smoother ordering process, smoother inventory management. You might even find a lot of contract savings. And really, at the end of the day, it's all about having a safer environment for your clinicians and the patients that they're providing care for.
Folks that are going to start thinking about the transition process, what kind of advice would you give them as far as it's a daunting task, correct? Mm-hmm. Is that fair to say?
It is, yes.
Yeah. So just tell me, from your standpoint, what do you think what do you say to somebody that's about to start a transition to really go through this process?
I would definitely say, first and foremost, get your supplier involved. Get someone that's worked through EHR transitions and these types of migrations. Again, involve all your stakeholders and involve a partner like PDC, right? I think we've been doing this a long time, and we help people along the way with these different migrations and figuring out how to improve workflows.
And what makes, you just mentioned, just elaborate on that a little bit. I know PDC's been doing it for a long time and you're a great partner, but why come to PDC? What can you bring to the table?
Well, I think what's special about PDC is we don't just sell products, we provide solutions. We really try to get into the weeds of what an organization is going through and dig deep into, how we can support them with their wristbands, their labels, their printers, making sure they're all connected and they're all working in the way that they should, right? For PDC, we've been in healthcare identification for over 65 years. Beyond that, I think that we like to solve problems. That's kind of the mindset that we come into this with is how can we make this easier for you? How can we make a workflow more efficient?
Much the theme of the Vizient Summit, imagine the possibilities, right?
Exactly. Yeah. Every hospital is different and has its own challenges. All of the workflows vary. You see that every customer, health system and individual location, they're not unique, or I should say they are unique, right? They're not all the same. And really, that's what we try to show up as is observing that workflow, observing your challenges, and helping you solve them and uncover how to make that a faster, more efficient process.
Awesome. Real quick, what if somebody wants to get in touch with PDC, what's the best way to kind of connect with you guys? Website or?
Yeah, absolutely. Please go to pdchealthcare.com. You can do the contact us page. You can reach out to us. You can connect with us through LinkedIn. You could find me on LinkedIn. Any one of us can get you connected to the right sales team that is all across the U.S. We've got a lot of feet on the street.
Great. Awesome. Good stuff. It's thank you for being our first guinea pig, our first podcast for the first 3 days, but definitely a great one and fascinating stuff with what goes on in the hospitals and what you guys are able to help everybody with. You just sometimes don't think about all that stuff, all the identification and all the things that happen with the health records, and it's so vital to everybody.
So critical, yes.
So critical, and having somebody like PDC makes it that much easier. So thank you so much for being here. Enjoy the rest of the summit. Are you going to stick around for the next couple of days?
Absolutely.
Yeah.
I'm excited. It's going to be fun.
It is going to be fun. Imagine the possibilities, right? Thank you so much, Melanie. Have a good rest of your time. Okay.